Hello, good morning and welcome to our IFG virtual event. I'm Catherine Haddon. I'm a senior fellow here at the Institute for Government. So we are back in lockdown, leaving the house only with our reasonable excuses. Pubs and restaurants are closed. We are eating in to help out. But the journey to these latest set of restrictions has been more protracted and more disputed than back in March. We now know that after opening up over the summer, the government had warnings from its scientific advisors from September onwards about the resurgence of the virus and calls for a further lockdown or circuit breaker to try and stem the flow of the virus. Case numbers, hospital admissions and tragically deaths have all been on the rise. The government say that the worsening picture of what was likely to happen in terms of NHS capacity was the trigger for going into lockdown again, a lockdown that the Prime Minister previously described as devastating. Meanwhile, the economic costs are visible both in the data and in its effect on many people's lives. But the UK government's approach to how it balances economic, epidemiological and other factors is far less clear. SAGE's published reports and minutes can dominate headlines, but the government has resisted calls from their own backbenchers to publish impact assessments of the new lockdown or an economic analysis. So we wanted to explore how science, advice and economic and other forms of advice are developed within SAGE, within the Treasury, how they're combined and used within government and whether that is causing problems and what can be done about it. Has the government set up a battle between economic and health considerations that shouldn't exist? And hugely importantly, how do other forms of evidence and other concerns, well-being, social impacts, operational concerns, how do they fit in? We've got a fantastic panel to discuss all of this. I'll come to each of them in a moment with an opening question, but to briefly introduce to them, we have John Edmonds, a professor of infectious disease modelling at the London School of Hygiene and Tropical Medicine and a participant in SAGE. Susan Mickey, professor of health psychology at UCL and also a participant in SAGE, its subcommittee on behavioural science, and also a member of independent SAGE. We've got Lord Macpherson of Earls Court. He was Treasury Permanent Secretary from 2005 to 2016 and is now a crossbench peer and a visiting professor at King's College London. And we have Nancy Hay. She's the Executive Director of the What Works Wellbeing Centre and a former civil servant. So many thanks to them for being here. And for those of you watching at home, thanks for joining us. Do submit your questions using our Q&A function. I will try to get to as many of them as I can through the course of this discussion. So, John, I wanted to come to you first. SAGE have been very prominent from early on in the crisis. Papers are published, the advice can be tracked. From your perspective, how does the epidemiological advice and the economic advice interact within governments, as much as you know? And what do you think when you hear people like Theresa May or others arguing for more economists to sit on SAGE?
I think it's important to understand that SAGE doesn't have a fixed membership. Experts are brought in as necessary, and generally speaking, it does have quite a broad range of experts. So certainly throughout this epidemic, there have been behavioural scientists, virologists, ethicists included on SAGE. So there is quite a broad range of views that come in, and the SAGE's advice reflect those broad range of disciplines. Currently, SAGE is not constituted to look at economic advice, so it's not that there aren't economists sitting on SAGE providing economic input into the advice that SAGE comes up with. That comes in separately into government. It is there. It's done by the Treasury and others within the government, and feeds in, I think, into the Cabinet Office level. So when the SAGE advice comes through, I think there is equivalent economic advice that feeds in at, around the same time. I think the problem is one of publication more than anything else. It's not that the economic advice isn't feeding into government decision making. It very clearly is, but you don't see it. So we don't see the counter. We don't see that side of the evidence. We only see, ever since April, and I'm very much happy that we do this now on SAGE. All of the SAGE advice is published as rapidly as possible, and the evidence supporting it is published as rapidly as possible. But what we don't see is the other side, the evidence supporting the economic advice itself and the evidence supporting that. And I think that is a little bit of a failure in terms of being able to get the government's point of view over and why it's come to decisions, because of course all the way through the government has had to balance these things off, and sometimes they will be in conflict. Sometimes I suspect very strongly that the economic advice and the epidemiological advice will coincide often, but we haven't seen that. It's really that we're not seeing the economic side of the evidence. It's not that it's not coming. It's not that it's not playing an important role in government decision making.
Nick, can I come to you? I mean, there's a bit of a mismatch in as much as SAGE is this, relatively high-profile body that publishes a huge amount of the work and thinking that it's doing. The economic advice, as John said, largely comes through the traditional route of the Treasury, a department through ministers and senior officials. Firstly, give us an idea about what you think of the way in which that economic advice is developed and incorporated. But also, this particular question about transparency, the Chancellor has said that there are no specific forecasts on the impact of lockdown. The government have resisted putting out equivalent economic forecasts. Do you think the government is failing in setting out how it is analysing economic factors and the impact that those are having?
Look, I think a more confident government would be publishing impact assessments. Clearly, economists are in the background at SAGE. I was looking at the minutes last night, and I see a senior Treasury economist was at the meeting as an observer on the 20th of September. I agree. If economists were going to be on SAGE, I think you'd have to reconstitute its function and objectives. I was struck by a lecture Gus O'Donnell gave, I think last month, where he drew attention to the National Security Council as a model where you can incorporate expertise alongside politicians. And what I would hope, I should also say I experienced in the financial crisis of 2008, Gordon Brown set up a National Economic Council to bring together various interests to talk about economic interventions. And I would hope that the Prime Minister or Mr. Gove or the Cabinet Secretary has convened some group where scientific and economic advice is distilled, and decisions can be taken in that context against a commonly understood framework. I mean, at the moment, I rather doubt that is happening. Look, I don't think you need forecasts necessarily. Economic forecasts generally aren't worth the paper they're written on and get overtaken by events, but you do need a framework for understanding the trade-offs, because I totally agree that generally economics and science will go in similar directions. I'm absolutely certain early on, closing down the economy probably made very good sense. But as this crisis continues and we become more knowledgeable, I do think there are trade-offs. Clearly, the government has decided to keep schools open on this occasion, which suggests that they are taking into account well-being issues. So, I mean, I know it always falls to ex-civil servants to suddenly become interested in open government and freedom of information. But I think if you're confident as a government, actually the more information you get out there, the better. And that in turn improves the quality of debate.
Susan, if I could come to you now. I mean, you're a member of the Behavioural Science Subcommittee, as I said. A lot of the work maximizing adherence to government intervention, something that's obviously hugely important right now with the second lockdown. I mean, what about that advice? What do you think would help in terms of getting that advice, getting traction within governments?
I think there's several things. One is that instead of us being in responsive mode only, where we're responding to very general questions about, principles of good communication or how in general you can increase adherence, I think it would be much better if we were asked advice about very specific policy issues. For example, the 10 p.m. curfews, fines for not isolating, moving from 2 metre distance to 1 metre rules. These all have very important behavioural considerations, which I don't know whether they were taken into account or not. So I think that's one thing. The issue of transparency, I think, is really important, because I'm aware there are behavioural scientists in working with the Cabinet Office in different parts of government. So I'm never quite sure, how much our advice gets taken into consideration by whom and how, because there's no feedback. So we don't actually know what does gain traction and what doesn't. And I really agree with Nick's point about a framework for understanding trade-offs. And that does mean that people from different scientific disciplines or relevant sectors do need to get round a table together. So I was on NICE's Public Health Interventions Advisory Committee for 8 years, and we had particular effectiveness reviews, but also cost effectiveness reviews. And we have everyone sitting around the table thinking about these issues, but not just as experts. We also had expert witnesses, i.e. people who were living, experiencing in the real context that we were trying to address. And I think this is another thing, more involvement and understanding of the communities that we're advising about would be really helpful. And to give an example of the 3 things I mentioned, all of them I could explain how, had behavioural scientists, I think, been at the table in the nearer where the decisions are actually taken rather than 10 steps away, I think it could have made a difference, because we know, for example, the 2 metre to 1 metre, my understanding is Sage always kept to the evidence-based conclusion that 2 metres is needed to reduce transmission. And a Downing Street review was set up that I was told did include scientists and economists, but we never heard who they were or what evidence they drew on or what their deliberations were to say we were moving to 1 metre. Now, one important thing to know about that from a behavioural point of view is actually, unless you're in an intimate relationship with someone, we all keep about 1 metre distance from each other. That is a normal social distance. So in effect, by moving from 2 metres to 1 metre, you're basically losing the concept of social distancing. And we saw that happening. So I think I'd say 3 things. One is being able to be more proactive in order to say, we think these are the issues. So, for example, we've known for many, many months, because I'm part of the group of researchers who are doing weekly surveys, that only 20% of people with symptoms are saying they're self-isolating for the 2 weeks. So we haven't actually, been addressing that at the time when we could have many months ago. So I think being able to be more proactive, being able to be more directly involved in specific policy issues rather than more general issues, and being able to be with other disciplines and relevant groups of people, as I say, including the relevant communities, for some kind of, to develop and to use a framework for trade-offs, which can then be shared with the public, and we can all understand, which we can't at the moment, on what basis decisions were made, because then you're in a position to evaluate it and know to what extent do we agree with that. And also, I think if you understand it, you understand the rationale, the evidence is that you're more likely to adhere.
Thanks. Nancy, coming to you now. Listening to all of that, obviously, we've been focusing very much on science versus the economy. There are, all sorts of other issues that we have learned over these many months that we need to be thinking about. I mean, what do you think in terms of the broader insights that social science, well-being, population health, how have those been incorporated into decision making? How does it look from the outside? And what do you think are the biggest gaps we have at the moment in terms of our understanding of COVID and lockdown effects?
I think it's interesting, a couple of things there that you said. This is economy versus health, this is science versus the economics. And I think neither of those things are true. I think these broader insights have been included, but they've been done, and you can see that in the changes to the second lockdown, actually, but less coherently and less transparently. And actually, what Nick was talking about, a framework for thinking about this, well-being offers that. So well-being in the context I'm talking about, it means how we're doing as individuals, communities, and as a nation, and how sustainable that is to the future, known in the Green Book as social welfare. So this allows us to look at a broader range of measures than just a very narrow lens in either economics or health, a broader range of things that we care about, so jobs and livelihoods, as well as economy as a whole. And also a broader concept of health, of the physical and mental health and different types of health impacts. But it also allows us to bring in things that we know matter. So the top drivers of overall well-being, which we've seen go all over the place for the first time really, are sort of mental and physical health. That includes non-COVID ill health. The relationships, both our personal relationships, our community relationships, and our social interaction around that, and our national relationships, our social trust, which is essential if we're going to have effective lockdowns. And then the economic ones, jobs and incomes. But the other thing is about the short and long term effects as well. So this is about how sustainable it is for the future. One of the things that is really clear from some of the economic decisions that have been made is that we know that some things have a disproportionate impact than we'd expect. So we know that there's a long-term scarring impact from unemployment, for example, particularly if it's longer than a year, and there's ways to mitigate that. So having a framework to consider all of that is important. The other thing that the well-being approach and to evidence starts to allow you to do is look at distribution, and Susan mentioned understanding communities, and it's really clear that effects are not evenly spread, and that can be true within groups and between groups as well. And so so for example, we can see that actually some kids are much happier at home, but those who are not happy at home, that's a real problem. We can see that with the free school meals discussion. We can also see that teenage boys' loneliness is affecting them, and that affects their mental well-being. And you can see that Department for Education put together a State of the Nation report on children and young people's well-being that starts to try and bring together that evidence base. I think the question we're kind of talking about today is who is included on which advisory mechanisms and how, and then where is it combined? I think there is I'm probably, having worked on freedom of information, I think there is a strong case for a protected space for decision making. And there's also a strong case for making sure you get the best advice possible, and making sure that those who provide it, who wouldn't normally be in the public space, are supported appropriately. And so I think I'd rather that everything was written down and there was accountability, even if it was 30 years later. On the other hand, I think there is a big gap between the public health advice, which is necessarily really clear, really simple, and the expert discussions, which is not being met very effectively. And I think some independent forum, we've heard NICE mentioned, we've heard a number of economic ones and SAGE, a way of doing that that brings together the global evidence base in a coherent way. NICE have done a brilliant job of doing live reviews, for example, bringing evidence into policy. I was struck by the conversation in Parliament at the Science and Technology Committee about this isn't our evidence to publish, was mentioned a couple of times, and that is interesting about who and which is taking the decisions. But I think there isn't a framework quite yet about how to do it, and I don't think impact assessment is a very effective one to do, not least because it always had that heading of unintended consequences, which was always ridiculous.
Thanks. John, can I come back to you briefly? I mean, firstly, this question about a framework and whether or not that, I mean, there's a sort of broader issue about whether there's a consistent strategy and whether or not the commissioning that you get in terms of potential policies that you can explore the modelling on is there. I've got a couple of questions though also, one from Gus O'Donnell, which is about whether or not SAGE could be publishing expected excess deaths forecast with and without the new lockdown measures. Perhaps that's more for you to explain exactly how the modelling work happens. There is also a question, though, from Jonathan Porter's always wanting to get in a interesting question. He asks about this idea of there's separate tracks in terms of advice going to ministers from the epidemiological and economic advice, particularly about, say, the generosity of statutory sick pay, where the likelihood of individuals to self-isolate is key to the health epidemiology and effectiveness of the measures. But the policy sits with DWP and with HMT, and how is that advice therefore being integrated and so forth. Perhaps that's a bit too specific, but I think it goes to this point that there's a different there's a confusion about how it's being presented externally as well as what's going on inside government.
Sorry, so there's a few things there. I'll try my best. So we started off with the framework, yeah. I do kind of agree with other panelists on this. I think it would be helpful, I think, if there was a clear framework, because then I think you could see what the what the strategy might be. So what are the government trying to achieve? And I'm not sure that has been consistent throughout. So I think we have had sometimes at times we've had quite a clear aim, protect the NHS, for instance. That was a kind of very clear aim in the early lockdown. But then later on, I don't think we stuck to it so much, and we had things like Eat Out to Help Out. So I think there's I think a lack of a framework and a clear long-term strategy has been a problem over the course of this epidemic, and we have therefore flipped a little bit from one focus to another as time has progressed. In terms of Gus O'Donnell's question, which was SAGE going to produce models with and without the effect of projections with and without the medium-term projections. Yes, is the answer to that. The trouble is we don't really have a good idea about the impact of the lockdown just yet, because we haven't tried this sort of thing before. So we have very weak evidence at the moment, weak evidence based on which to make these projections. So they're very uncertain at the moment. And I'd like to make that as a general point. I think it is incredibly difficult to make decisions during epidemics. There's this sort of awful tyranny of the sort of exponential growth, which means that decisions don't get any easier if you put them off. In fact, they get harder, and so you're going to have to make decisions quite often, quite frequently. You're going to have to make decisions when the evidence is very poor. That you don't have the perfect study to point you to tell you exactly what to do, and you're going to have to make a decision anyway, because it's not going to get any easier if you put it off. And so I have huge sympathy with the government, facing that kind of predicament. And maybe it is a little bit of a lack of confidence to come out and say that it isn't easy, and mistakes will be made inevitably when in hindsight. But actually, at the time, it's done for the best purposes. And again, I think this is where a framework or some clear strategy might help actually in being able to see why decisions were made at a certain time, and so on. The last question, I forget what it was about. This was about economic evidence.
Yes, it was about, he focused on the issue of statutory sick pay, but I mean, the main point is about how actually a lot of these decisions, intertwine economic and epidemiological concerns, i.e., the health outcomes and the economic outcomes are both concerned, but also the behaviour is affected by the economy as much as, the rules that are put in place.
Yes, so I think there is there is an argument for bringing these things together, perhaps earlier on. I think that Eat Out to Help Out is an example. And the other, I can't imagine many epidemiologists suggesting that that was a good idea, quite honestly. So that was obviously one other side of these things maybe should have been put together in a bit more and integrated throughout in a slightly better way.
I mean, Nick, on that, Eat Out to help out, and now obviously we've gone back to full furlough through till March. So there was a push, it feels like, from the Treasury to try and open up parts of the economy that didn't seem to be driven by epidemiological concern. It seemed to be driven largely by economic concerns. Is it? I mean, where do you think that's coming from in terms of the Treasury, its outlook? Was it very much focused on the sort of short to medium term concerns, as far as you can tell? Was it thinking through what are the longer term effects on these sorts of things?
Well, look, I don't know what discussions went on in the Treasury about Eat Out to help out. I think in the summer there was this optimism around how you could create a V-shaped recovery in the economy, and at that point the virus numbers were looking pretty good. I mean, what surprises me with hindsight is that on each occasion with the virus, Britain tends to be several weeks behind continental Europe. So things were beginning to pick up in France considerably earlier than Britain, and yet the policy response continues to be to be late. And coming back to these policy issues, I completely agree with John that taking policy decisions in conditions of uncertainty is really difficult, and we all think that there's some fantastic sort of model where you can take every single consideration into account and come to a sensible decision. Life is not like that. The evidence base is evolving the whole time. Nevertheless, in my view, at any point in time in a crisis, if the government can get things about 2/3 right, it's doing a pretty good job. So you're always going to criticize the government, but you just kind of want it to be doing broadly the right thing. Now, the Treasury has the capacity to take into account things which go beyond economics, and I think the whole issue of the value of life is really important. I mean, bear in mind though that people and therefore governments can be quite irrational about the cost of life. Investment appraisals show that people attach a lot more to lives lost on the railways than they do on the roads. So the Treasury's job is to try and impose some discipline, bring science in, bring behavioural economics as well as more traditional economics to the party. When I was at the Treasury, I chaired a heads of analysis group which brought together scientists, statisticians, economists, social policy people. I hope that group still exists, because actually a lot of this is how you organise Whitehall and how you channel combined advice into the decision-making bodies. I mean, I mentioned the National Security Council earlier. There's a very long tradition of bringing the intelligence agencies together with the Cabinet Office to try and get a single combined view of the world. And I think actually the one lesson of this crisis is we need to get smarter at doing that.
Thanks. Nancy, I think you're waving at me. Do you want to come in? Don't forget to unmute yourself, and then I'll come back to you, Susan.
So I think this separate tracks of advice thing is really interesting, and it applies to Treasury and health as much as it does to any other department. And actually security can also be quite isolated from health things, which can also be a security issue. So this idea of how we bring in, every department sees the problem and potential has policy levers through its own areas, whether that's policing, whether that's education, we see the solutions through those areas. So there needs to be a way in the centre of government that needs to be equipped properly to do this. combining of all that separate tracks of advice, and understand the role each department and the levers they have can play in achieving inclusive and sustainable well-being for a society. I think also the importance of objective and subjective measures comes in quite here, because is it about, there was also anxiety and fear cause, it may be a different issue. So do you feel, are you safe? Do you feel safe? Are two different policy problems to solve. And that objective data can tell you some different things as to the subjective data. And I think wellbeing can also help in other ways, in that individuals, like governments, make choices based on what's most important to them. And actually, if in your situation, the job or the relationship is more important than the bigger question, you'll make a different decision about whether or not you quarantine, for example, or you obey the rules. So, but I think it's worth saying here that having a job is a health outcome. Having enough money is a health outcome. And so I don't think there are as separate, and it's certainly not as binary as sometimes it's been made out for purposes of debate.
Susan.
Well, I strongly agree with everything that's been said, but I wanted to pick up on a couple of points. One of the issues, which is I think a bit different than the framework for decision making and framework for how you deal with trade-offs, is the overarching strategy. And I think it's really not been clear, and still not clear, whether the overarching strategy is elimination, zero COVID, getting the transmission rates down to such a low level that one can gradually open up things again, which has been achieved in many other countries in different continents, and is also signed up to, for example, in Scotland. Or is it one of containment? And I think that this is where the delay comes in, partly because of that, because I think it's not clear what the overall strategy is. Are we living with it, or are we really going to try and drive it down and keep it down? And that does make a difference as to where you put your resources and how you put your resources. For example, the test, trace and isolate system. And also it is relevant in terms of what we touched on at the beginning. Do we have the right people around the table? And one of the reasons why Independent Sage was set up was a perspective that there was a lack of public health experts with expertise in pandemics. And so, WHO's advice of, you can't go quick and hard enough, test, etc. Potentially that's a reason why that wasn't taken up and why we haven't gone down a clearer sort of elimination route as a target. And partly why this is problematic. I think it's not only problematic because policies are chopping and changing, and one's envisaging a future of continual lockdowns, is that also it doesn't give a framework for the population to really understand things within. And if there's not a kind of mental model that people have as to why things are happening and what the exit strategy is, then it's very difficult for people to keep morale and therefore keep adherence. And similarly, I think with the communication part of things, that communication isn't just about slogans, hands, face, space or whatever. Communication is done by policies. And over the summer, if you have a combination of policies, it's been mentioned about eat out to help out, but there was travel corridors, go off and enjoy your summer, moral duty to go to the pub, go back to work, to have lunches in the middle of the city, to save the economy. All of these are actually communicating business as usual. And that's very confusing for people when they're having to switch from this is a huge crisis and we have to all lock down, from actually, things will be fine at Christmas and, go about your everyday business. So I think it's a real problem on a number of levels. And I just wanted to say one other thing at this point, which is none of us have talked about inequalities. And I think this is really important. Oh, sorry. Okay, I will reinforce what you said about inequalities. But I suppose this comes back to the criteria you take into account when making decisions. And what I would say is that I haven't seen, it's not been visible how And what we know is the pandemic itself has increased inequalities to what was already a very unequal society, and government policies have further increased inequalities. And I haven't seen how that is really being factored in to decision making.
Thanks. And we had a question about how quality of life assessments are being brought into SAGE discussions, and whether NICE should ignore them if they're not being used. And also we had a question from Giles Armstrong, a frontline NHS doctor, which was actually, Susan, I think you've just covered that, about what their input there is in terms of how the public are understanding these messages, and the ambiguous nature of them since the Protect the NHS in the original one. So I think we've covered that. Nick, do you want to just come in on that question about the sort of wider inequalities? And Jill Rutter, I know you know her, has also asked a question about whether there should be an R budget, which should effectively, weigh the impact of individual measures on both the virus and the economic and wider costs. And obviously we have seen, statement after statement from the Chancellor of, different sort of setting out the Lakers package and then having to adjust it. Clearly, with the crisis going on, you've got to be iterative, but should there be more work to actually try and incorporate those in a sort of budgetary sense? Does the Treasury have to get out of its usual ways of working?
Well, the Treasury has been capable of doing this sort of analysis for years. Ultimately, it's for the government to set out its priorities into, what does it want to achieve in terms of distributional effects, and then you can seek to optimize policy accordingly. I've been just picking up on Jonathan Portes's point a while back. Actually, often interventions at the lower end of the income distribution will both be positive for the economy, but also positive for wider well-being and the growth of the virus. Jonathan mentioned statutory sick pay. I'd also mention when it comes to transfer payments, universal credit, which actually, some of us were critical of the way that was set up, but it seems to be working very efficiently in this crisis. So it is possible to use that to get money to those who need it most. It's tempting to blame the Treasury in these on these occasions, and obviously Mr. Sunak is the political leader of the Treasury. What we don't know, because it's not being published, is what sort of analysis Mr. Sunak is getting. But any chancellor will want to understand the distributional implications of policy, and look, insofar as the Treasury can develop alongside it a framework, as Jill suggests, where you're looking at the impact on the virus alongside the impact on the economy, that is kind of the ideal situation you want to get into. Now, I totally understand why at the beginning of this crisis that framework would not exist, but the one thing we do know is that it's going to go on now for months. The idea that this virus is going to be wiped out by next summer seems to me a very remote one, and we're going to be going in and out of degrees of control, if not lockdown, and it should be possible during this period, as indeed with a world war, to develop analytical frameworks which you don't use in peacetime. And actually, there will be benefits coming out of this crisis in terms of better analysis and better coordination of analysis. So, I remain optimistic.
Thanks. John, can I come back to you? Some of the discussion that we seem to be having, it goes to the heart of how the government has organised itself. SAGE was an ad hoc committee able to be got up in an emergency. It's now been going on for almost like it's going to continue for a much longer period. Is part of this about the government not having adjusted in those earlier months and perhaps built itself a sort of wider, robust system of how it's bringing evidence together, so that too much is now being heaped on SAGE's shoulders?
It's a good question. I don't know, possibly. I mean, the government has tried to put in mechanisms to, I mean, that's the point of the JBC, for instance, is to take some of those things off SAGE. So some of the routine decision or routine analysis has been taken off SAGE. So we were doing it through the modelling subgroup of SAGE SPI-M in the early part of the epidemic. And some of that analysis has been taken off and been done by JBC now, and done at a much finer scale. And the resources put into it have increased enormously. So we do have much better situational awareness now than we did before. So I think it has done some things like that. Yeah, I mean, I think we're all saying there isn't an overarching framework that we are party to, that I've seen, and of course I don't discuss things with the politicians, so perhaps they do have one, but it's not apparent to outsiders, at least. But I think what's what we're going back to is, if we had an overarching framework and a clear strategy, then it makes life easier for us. For instance, if you give us a target, then we can try and aim for it. If we don't have a clear target all the time, it's quite difficult to know what you're aiming at.
Nancy, I wanted to come to you anyway. I mean, one of the issues that we talk about a lot in terms of evidence and policy making is, the closeness to politics, and not just to the political decision making, but also to those political debates. I mean, this is obviously a hugely emotive topic. All of these issues have a lot of values concerned with them. Politicians are quite rightly taking a close interest in the fact that people are at the moment confined to their homes. But what are the issues there in terms of almost politicizing this debate, and for those who are trying to do, think about evidence, to explore it, analyze it, talk about it in public, when it is all so emotional? Is it difficult, and should the government be doing more to sort of almost protect that debate and to allow it to have a bit more freedom?
Clearly, I mean, we are politics, we are the community, that we all of our civil society, this is who we are. The government is just one part of that, trying to help the civil society and communities and businesses do the things that they do. And actually, I think the evidence here is a public good. And I think, but I do think there should be a protected space for decision making. I do think we need to be careful about protecting the advisors themselves as well, who may not, who may not normally be on a public stage because they're not politicians, but also because we want to get the best possible advice in, and therefore that might dissuade some people from doing so. I think a couple of things. I think disaster management is a really good example where you could have a knowledge management function that is separate from government, at least collecting what's known about how to respond in disasters of all types, and because they are by their nature rare. But that knowledge management function becomes really important. You need to find the evidence of what happened in Manchester, in different parts of the country or the world quickly, and the experts quickly. And so I think there is probably a good case for sort of a what works function around disaster management and disaster recovery, which could be fairly easily done, at least speed up some of the responses and things that we know we need to think about beyond from the basic needs, but also the social and cultural needs as well for people. And Nick was saying that the framework could be there for emergencies. I disagree. I think this is something we should have on a regular basis, a framework for decision making more broadly. I think the data side of it is there. I think we are starting to get the framework. It may need to be faster, but I think we have a broad framework. We have a wellbeing framework in the UK. There are 140 of these around the world that give you a broad sense of the data. The decision-making side of it hasn't quite caught up. I agree with that, and it could be different in different contexts as well.
Okay, Susan, back to you. I mean, the strategy at the moment is again relatively clear. It is again back to protect the NHS, try to get the R number back down to the point at which the government certainly say they want to go back into the tiered system. We could debate separately. Perhaps John has views as to whether or not that would work, but If that's the strategy, obviously the key thing, again, we talked about it a bit earlier on, is compliance or adherence, to the new law. So if that framework were in place, what should it be focusing on as its greatest priority in terms of understanding whether the measures are having an effect and iterating through the lockdown? Because there's a good likelihood, we've already seen some changes to the regulation, or some discussion about changes to the regulations too, as politicians have brought up issues. What kind of thing and focusing on if that's now the strategy of success?
Well, a couple of broad issues that are very important in terms of being associated with people's adherence to what are obviously very challenging restrictions is trust in those deciding on and asking people or telling people to adhere to them, and also perceived fairness is also associated. And with both of those, there's obviously huge room for improvement. The last data I showed, I think it was only 29% of the population trusted the government as handling the pandemic well. And there have been real issues about perceived fairness across different groups. So we obviously just recently on the tier system had the issue about North versus the South and differential treatment. We had students kind of being, or young people rather, being blamed for rising infections. Issues like you can't have 7 people, trusted family members in your back garden, but you can have 30 people together if you happen to be on a grouse moor holding a gun. These things are all communicating a kind of us and them sort of principles. And what SPI-B, the Behavioural Science Advisory Committee, has been saying all the way along in acknowledging how important these issues are, is the importance of the government really engaging with communities, really listening, really understanding, and really trying to take a sort of joint partnership approach to understanding what the nature of the problems people have, the challenges to adhering to the restrictions, and then sort of co-producing. We talk about this a lot in social and behavioural sciences, co-creating intervention strategies. So, doing this with the communities, whether they're geographical, occupational, demographic communities. And that way, firstly, I'd suggest the strategies are more likely to be effective. Threatening huge fines for people not isolating, when we know that the main reasons are having to go out for caring responsibilities outside the home, to go for jobs and for income, and also to get provisions, is not likely to be helpful. But if there's more engagement with communities and more understanding, then not only are the strategies likely to be more effective, but also those communities are more likely to engage because they will feel ownership and part of the solution, not being blamed as part of the problem.
Thank you. I'm just going to read out some of the questions. I think we've covered quite a few of them. One that we haven't was the impact on Black and Asian populations, and the government, what they're doing going forward to tackle this, and also to sort of understand it. If anyone can touch on that, that would be useful. We've also got a question, to some extent, Susan, you just touched on it, about in sort of pandemic history, the willingness of people to observe tough restrictions on personal behaviour, whether that's likely to keep falling off, and what the government might be doing to deal with that. You've just touched on some of those issues. And another question about, once a vaccine is available, it won't be provided to everyone, but might be provided selectively. What has been factored in terms of, again, that big question about fairness and the impact that will have on, obviously, there are, I presume, also epidemiological questions about all of that. John, if I could come back to you, just to wrap some of that up a little bit, it feels like there's a bit of a wider issue that we've seen through the course of this year from the government in terms of planning forward for the next phase. You know, we are now in another lockdown. The government have that as a policy. It doesn't mean they've got time or whatever. Obviously, they're dealing with huge issues throughout all of that. But as we saw coming out of the first lockdown, as we saw, you know, coming to the end of the summer and approaching autumn, what should the government be focusing on now? What are you guys focusing on now in terms of issues, whether it's the 2nd of December, whether it's Christmas, whether it's into the new year, in terms of the next phase? And I mean, dare I ask, will a return to a tiered system actually work, do you think?
Well, take that one first. I think tier 3 has probably worked to some extent. So tier 3 at least, which is the highest level of restrictions, has slowed the epidemic in those places where it's been in place. You know, may have reduced the reproduction number to somewhere close to 1. I think that's so. I think that the problem with the tier system is that the other tiers don't slow the epidemic very much, and so places that are in the lower tiers inevitably end up in the higher tiers. And then if we can slow the epidemic down or at the higher level, but that's not a very good outcome, because then everyone ends up with high incidence. So it's not a very sensible way of doing things. The lockdown is designed to reduce incidence everywhere, and probably will work in doing that and reducing incidence everywhere. After we release from lockdown, we will still have to have restrictions in place to stop it coming back. The idea is to bring the incidence down and then hold it at that lower level rather than at the level where it is now. And so I expect that. So we're not going to just be returning to, you know, eat out to help out. Or I will really hope we don't, you know, come December, because that would be really unwise. So we have to stay with some restrictions in place and keep the epidemic at a low level. And then I think we do, looking further into the new year, I do think that we will see vaccines coming on stream in you know, sometime in the early part of next year. Whether it's right in the new year or a bit later, I don't know. But I do think we will see vaccines being used, and that does change things, because that does allow us then to start to relax a little bit more. I mean, we're not going to be mass vaccinating the entire country because we just will not have the vaccine doses available. And of course, we'll still have to sort of introduce the vaccine very carefully and evaluate its effectiveness and safety very, very carefully. So it would be unwise perhaps to vaccinate the lowest risk groups immediately, just because, you know, perhaps the benefit risk ratio we're not sure of exactly yet. So I think we will see vaccines being introduced to the highest risk people first, and I think that's perfectly acceptable type of strategy. But yeah, I mean, I think we will start to come out of this kind of nightmare of this epidemic, you know, from, I don't know, I would say I've always felt that it's around Easter, you know, around a year in is when we'll really start to come out, because we will be vaccinating, we will be able to control the epidemic better. And it is possible that these other interventions that are sort of being mooted at the moment, I mean, Liverpool is now going through a mass screening. It is possible that those could help to reduce incidence and keep it low in the intervening period. I think there's a lot of work to do to ensure that that might be the case. But you know, it's an example of other technological solutions that are coming on stream that could help in the coming months.
Thanks, Nick. And then Susan and Nancy. I mean, what would you all want to see a focus on in the sort of coming month? You know, as we approach Christmas and into the new year, what are the sort of priorities the government should be thinking about now in terms of what we've talked about today?
Well, I think clarity on the strategy and then communicating consistently with the strategy is really important. I think the comms so far in this crisis have tended to flip-flop from excessive optimism to, quite frankly, you know, a degree of pessimism. And what the government's role is to provide leadership and consistency. From a more narrow perspective of the Treasury, I would hope also they are looking at how you get out of this crisis economically and really homing in on the cost effectiveness of interventions. I was slightly disappointed by the furlough announcement yesterday. I think it's going to prove excessively expensive. I think it's a reaction to being behind the curve. We're now, Nigel Lawson once said of the Treasury, it's got two modes: too little, too late, and too much, too late. And I think we could be in that sort of territory. So developing a really good program to take the economy back into growth mode whilst minimizing the implications for the virus, I think is absolutely critical for well-being across the country.
Susan.
Well, I think whilst we wait for a vaccine, we don't know when it'll come, we don't know how effective it'll be, we absolutely need to sort out the test, trace and isolate system. I mean, if you look around the world and see which countries are now doing pretty well, they're those that have managed to get the virus down to a low level and then have a really good test, trace and isolate system, which can intervene quickly to suppress the inevitable outbreaks that will happen. But that means really changing things at every level, the testing, making sure it's accessible. And from our data, only 50% of people still know what the three key symptoms of coronavirus are. So we can do much better in that. We know that tracing contacts is, quite frankly, abysmally low, nowhere near what is needed. And then I touched on the isolation before and what's needed to make that work. I think the whole actual design of the system is broken, and Independent Sage has put together a 7-page blueprint of how this could be done differently. But I'm on a Lancet commission where we're hearing presentations from countries all over the world. It's so different in many, many countries, even much poorer countries, where people get, when they're isolating, they get visited every day, asked, how are you? Do you need practical help, like putting out your rubbish, your provisions, checking on symptoms, psychological support? People are offered other kinds of accommodation, often free, and so I do think if we can get the system sorted, which does mean making it local by people who understand their communities and the communities trust those who are contacting them, that if we can do that, then we're in a really good chance of being able to get back to a more normal life without having to face these draconian restrictions. But it does mean learning from the rest of the world.
Thanks. Nancy, your final thoughts.
So for me, this has got to work, and the length of the lockdown is really important, because the longer it goes on, the longer the harms are. And so we need to make sure that we make it as easy as possible for people to do it. And there's a couple of things I'd probably look out for then. One, and Susan's picked up really well, is that the communities are key here, and as are our emotional health. So as is social capital and fairness. So I would look at where the multiple drivers of wellbeing are affected for where the real harm is. So where people are affected in their physical health, their relationships and their jobs. And that's where the combination you get is really quite volatile. I'm worried about people who are unable to meet their partners, and what that means for the future for our single population, as well as those who are overcrowded in their spaces and can't physically be in that space. But lastly, I'd probably say that social capital here is key. Fairness is a part of that. Our relationships and communities are part of that. But that's what brings us resilience and helps us bounce back, whether that's an economic shock or any other shock. And I'm really pleased that the Treasury is looking at what's cost effective in that context. And I think that applies to what makes an effective law as much as anything else, but that's a whole other different discussion. So my main bit is look out for the main drivers of wellbeing: the physical health, the mental health, the social connection and the jobs, and then the social capital bit will give us resilience, and our communities are key to that.
Okay, well, a whole long list there of recommendations for the government, and no doubt things that we will come back to again and again. We're out of time. Huge thanks to my panel for being online with us today. But also, we've been talking about experts and the role of SAGE, we should also offer them our thanks. They've been working very hard for many months to get the country through this emergency, and a huge effort from all of them. As I say, this is a topic that I'm sure will keep being relevant in the coming weeks and months, and we'll come back to. At the Institute for Government, we've got a report coming out in a few weeks' time looking at science advice during this crisis and SAGE's role in that. So keep an eye out for that. And for more events, explainers, comments and reports, do visit our website, instituteforgovernment.org.uk, and our podcast Inside Briefing, where this will be available hopefully later today. Thank you all, and goodbye for now.